Welcome to this HIPAA compliance training, presented by Dr. Carlos Fernandez for Redbridge Insurance Company. Today we will explore how HIPAA, the Health Insurance Portability and Accountability Act, protects patient information and promotes ethical and legal standards in healthcare and insurance. We'll discuss its origins, its main rules, and how each of us plays a critical role in safeguarding protected health information, or PHI. This session is meant to strengthen our understanding of confidentiality, security, and accountability, principles that define our company's professional integrity. By the end of this session, you should be able to describe the main goals of HIPAA, identify what PHI is, and recognize privacy and security requirements. You will learn how to apply HIPAA principles in your daily work, whether that's handling medical records, processing claims, or communicating with providers and patients. We'll also cover what steps to take if you ever suspect a privacy breach. Ultimately, this training ensures that every team member contributes to maintaining compliance and protecting our clients' trust. HIPAA was enacted in 1996 to improve the efficiency of the healthcare system while ensuring the confidentiality and security of patient information. It serves two major purposes. First, to protect patient privacy and prevent misuse of health data. Second, to make health insurance more portable for individuals changing jobs or insurers. HIPAA established national standards that apply to all healthcare entities, creating a consistent framework that prioritizes both patient rights and data integrity. There are 4 essential rules you must know. The privacy rule, which governs how PHI can be used and disclosed. The security rule, which protects electronic PHI through administrative, physical, and technical safeguards. The breach notification rule, which mandates immediate reporting of data breaches. The enforcement rule, which outlines penalties for non-compliance. Together, they ensure that health information remains private, accurate, and secure. PHI includes any information that can identify a person and relates to their health condition, treatment, or payment. It covers names, addresses, phone numbers, social security numbers, lab results, and even photographs or biometric data. Whether stored electronically, written on paper, or shared verbally, all PHI must be treated with the same level of confidentiality. Always ask yourself, could this information identify a patient? If yes, it's PHI. HIPAA applies to covered entities such as healthcare providers, insurance companies, and healthcare clearinghouses. It also extends to business associates, any external organization or individual that handles PHI on behalf of a covered entity. In Redbridge, this means every department involved in claims, case management, provider coordination, or auditing must follow HIPAA standards strictly. The privacy rule defines how PHI can be used and disclosed. It ensures patients know how their data is used, gives them rights to access their records, and restricts unnecessary sharing of information. This rule applies to all forms of PHI: oral, written, and electronic. Every employee must understand when disclosure is permissible and when written authorization is required. Patients have powerful rights under HIPAA. They can access and request copies of their medical records, ask for corrections, and see who has viewed their information. They may restrict certain uses or file complaints if their privacy is violated. Respecting these rights is fundamental to building trust and maintaining transparency in healthcare. The security rule focuses on electronic PHI, EPHI. It requires organizations to implement safeguards in 3 areas: administrative, policies, procedures, and staff training. Physical, securing facilities, workstations, and equipment. Technical, encryption, authentication, and access control systems. Every employee who accesses digital systems plays a role in maintaining these safeguards. Administrative safeguards establish a culture of compliance. They involve performing regular risk assessments, limiting access to PHI based on job role, providing ongoing HIPAA training, and assigning a compliance officer. Documentation is key. All policies, training sessions, and access controls must be properly recorded to demonstrate compliance during audits. Physical safeguards protect the physical environment where PHI is stored. This includes controlling facility access, locking file cabinets, restricting who can enter secured areas, and ensuring screens are not visible to unauthorized people. Always log off before leaving your workstation and dispose of paper records by shredding them securely. Even minor lapses in physical security can lead to major data breaches. Physical safeguards protect the physical environment where PHI is stored. This includes controlling facility access, locking file cabinets, restricting who can enter secured areas, and ensuring screens are not visible to unauthorized people. Always log off before leaving your workstation and dispose of paper records by shredding them securely. Even minor lapses in physical security can lead to major data breaches. This standard requires using or sharing only the minimum amount of PHI necessary to perform a task. It helps reduce exposure and limits risk. For example, if you only need a diagnosis code for a claim, don't request the entire medical history. Always apply the need-to-know principle. If you don't need the information, don't access it. HIPAA violations can be both intentional and accidental. Examples include discussing patient cases in hallways, sending PHI via unencrypted email, or leaving records on a shared desk. Even casual comments about a patient can lead to breaches. Always remember, confidentiality extends beyond the office. Never share PHI on social media or outside secure channels. A breach occurs when PHI is accessed or disclosed without authorization. If you suspect a breach, even accidentally, report it immediately to the compliance officer. Timely reporting helps contain damage and ensures required notifications are made to affected individuals and, if necessary, the Department of Health and Human Services, HHS. Never try to hide a breach. Transparency protects both the company and the patients. Violating HIPAA can have serious consequences. Civil penalties can reach $50,000 per violation, and intentional misconduct can lead to criminal charges or imprisonment. Organizations may face reputational damage, financial loss, and government audits. The best protection is prevention. Stay informed, follow policy, and ask questions when in doubt. HIPAA compliance isn't limited to policies, it's a daily habit. Always verify the identity of anyone requesting PHI, use secure systems like ROS or encrypted email, and never discuss patient information in public areas. Lock your computer, secure your notes, and maintain professional discretion at all times. Each small action helps maintain confidentiality and patient trust. If you suspect a privacy or security issue, follow company reporting procedures. Report directly to your supervisor or the HIPAA compliance officer. Provide factual details about what happened. Do not assign blame. Quick reporting allows the company to take corrective action and prevent further harm. Remember, speaking up protects everyone: patients, staff, and the organization. To summarize, HIPAA safeguards patients, supports trust, and maintains the integrity of our healthcare system. Confidentiality equals respect, and compliance equals professionalism. Each of us is responsible for ensuring that PHI remains private and secure. If you see something, say something. Together we uphold Redbridge's values of responsibility, ethics, and excellence.